got fired this morning from a company I have been working at for the last 8 years. I've had the same boss for the last 8 years, and yeah, it happened this morning. 9 a.m., I had a meeting booked with my boss. Our HR business partner immediately joins the call. They tell me that due to restructuring, they have to make hard decisions, and they have decided, after review at all leadership levels, that my job will be terminated. This came as a massive shock. There was no performance improvement plan. There was no conversation about how I could have been performing better. They essentially just told me, effective Friday, your role is no longer here. My only question I could muster the strength to ask is like, what's happening with my team? Are they also being let go? And they said that they could not answer that question at the time.
I think it's finally time to spill the tea on how I was let go from my 9 to 5 job while on my honeymoon. I don't know why I'm so nervous to talk about this. I was at this company for 5 years. My mom worked at the company for 35 years. Even though I was let go so easy, I still felt some sort of loyalty. We're spilling the tea now. Essentially, I was 3 days over my PTO for my honeymoon, and I was under the impression, based on multiple conversations, that we might be able to work something out because I would be out a lot of money switching this honeymoon around because we didn't buy trip insurance. I was told on the Thursday or Friday before I left, if I moved forward with my honeymoon and I took those 3 days extra that I did not have, that my company would take that as my resignation, which, by the way, you can't do that. You can either fire them or they can resign. You can't tell someone they're resigning. It doesn't work that way. And I told them I was not resigning. I would be back on this day, and I would also be working from my honeymoon on those days. On the day that I was supposed to be due back to work, I was on my email sending things out, doing my job. The next day, I get a text from a coworker asking what's going on. And I said, "What do you mean?" They proceeded to let me know that an email was sent out that I was no longer working for the company, which was news to me because nobody reached out to me to tell me that. To find out that I was fired with no contact from anybody. Didn't know what to do. I was still on my honeymoon, so I waited 3 more days until I got home. Figured surely the Monday that I told them I would be back in my home office, something would come up. I didn't hear anything Monday, and I didn't hear anything Tuesday, and I had no access to any of my emails. Thank the good Lord I didn't book any of my honeymoon on my work email, or it would have been completely screwed. I wouldn't have had access to any of my documents to get back into the United States. So I don't hear anything. So I obviously have to reach out to my HR from my own personal email. And that's when they proceeded to tell me that my last day at the company was a week prior. So fast forward 3 weeks, I am talking with the state, I'm talking with EDD. I had to do a 30-minute interview. I'm trying to figure out some options and what's going on. And after the 30-minute interview, I'm told that even though my company said that they would mark me as terminated, they told the state of California that I quit due to personal reasons. Luckily, the state of California, what companies say as surface level, that is why they do intensive interviews. They told me that after 5 years, only asking for 3 additional unpaid days off, and for and I quote, very important life event, I should have been granted those days and I should not have been fired over it. I think it was a push I needed to go full time with content creation. And I'm honestly really grateful that it played out the way it did. And I know in a year from now, I'll look back and be like, thank God that I got fired over my honeymoon.
Regret becoming a nurse because I felt like, oh my gosh, this is not for me. No, bedside wasn't for me. Outpatient nursing, I love my job. Never thought I'd be able to say that. So take this as your sign to leave the job you hate. Nursing is not like other jobs. I always used to be the person that was like, oh, I can do anything for a year. I can stick this out. You know what? No, nursing is not the place to stick it out. If you are absolutely miserable, find something new, because that is the beauty of nursing. Being a nurse is hard, and you should absolutely take advantage of the flexibility. So I was in med surg on nights for 2 years, and I went outpatient last August, and I truly have zero regrets. I am never going back inpatient. It is not for me, and that's okay. There are people that inpatient nursing is for, and I am so glad we have those people because we need them. But for me personally, since going outpatient, my quality of life has dramatically improved. Even though I'm working more days a week, I love my life. I do not dread going to work. I don't have any pre-shift anxiety. I cannot rave about how happy I am to have found outpatient nursing. You're too young to be miserable. Take advantage of how flexible nursing is and how easy it is to find a different job. Obviously, some jobs like outpatient nursing can be a little bit trickier to secure, but I promise you it's worth the hustle because there's a job out there that will bring you joy and you won't dread it. It can be wonderful and you can enjoy your life again.
I feel like venting today, so let's talk about the things I hate about being a nurse. Hate is a strong word. These are like icks. You get hired for one thing, you make all your little friends, and guess what? One day, whenever they feel like it, they could just choose to not put you on the floor that you got hired on, where you feel comfortable working. Hospital's short on any other floor, they'll just put you there wherever they need you. And sometimes people are nice, but most of the time nobody wants to help the new girl. Being on a whole new unit randomly can kind of feel like, I don't know, being a travel nurse. Except when they float you in your staff, you're not getting paid like a travel nurse. And like loyalty pays just so little. Unlike my break, and if something happens, I have to immediately stop and run over to wherever. It doesn't matter who's covering you. Like, that's what's expected of you. Which is fine, because, you know, if it's important, then you go. But guess what? Those 30 minutes are taken out of your check no matter what. Unpaid lunch break. Also, there's like 5 million nurses, but somehow we're always like short-staffed. The staffing ratios can be so unsafe. If you complain, then you're a diva. But it's better to be a diva than lose your license.
You know what I hate? And this might be a hot take. Please, can we please stop asking for microscopic details during nursing report? Like, listen, maybe it's because I'm a new grad nurse on a med-surg floor and I'm still trying to figure things out, but I only want what's important in my report. I don't need to know in which nostril the NG tube is in. I don't need to know that the CT was negative a year ago. I don't even need to know where the IVs are at, honestly. Why? Because I already know that. I already looked up the chart ahead of time because I have trust issues. And honestly, after you give a report, I'm going to look at the chart again just to recheck everything. But when I'm giving you a report and you're asking these questions like, where's the midline, or did the patient have a BM 3 days ago? Well, the chart's right in front of us. We have it open. And what do you mean a BM 3 days ago? I wasn't even on the floor 3 days ago. And then you tell me, can you speak slower, please? Why are you writing down every single word verbatim? The chart's right there. Why are we doing this? Then I clock out, I'm going home, and I see you checking everything on the chart anyways. Why'd you ask me that? Why? Listen, I probably give trash report. I'm a new grad. I'll get better, but come on. We have all the information in the chart. Let me go home and sleep.
Have you guys ever noticed that no other profession, from what I've noticed, in my opinion, this is just my opinion, you don't have to agree, but I feel like no other profession treats each other worse than nurses treat other nurses. And I'm almost a nurse practitioner. I've been in NP school now I'm finishing up, and even like I've seen the way NPs treat other NPs, I've seen the way PAs treat other PAs, doctors treat other doctors, and no one treats each other worse than nurses treat other nurses. And I don't know why. Like the way that some nurses treat, especially new nurses, is it's appalling. It's truly appalling. Anyways, moving on. Look how good I look today, though.
I'm going to be completely honest. Some days I really hate working in healthcare. Today was so frustrating. I had no MA. I had some NP students who helped me a lot. I just rely so heavily on my MAs. Like, I needed blood today. I needed EKGs. I need ears cleaned out. I needed I needed vaccines given. I needed, like, COVID tests run, flu tests run. Like, when I don't have one, my life literally crumbles. I charted all throughout my lunch and admin time. I saw 3 new patients in a row this afternoon. It is literally 6 o'clock and I just wrapped up work. I didn't make it to the gym. I have done nothing for me today. I've only done things for other people, and that is so mentally tasking.
I literally got fired from my job during Nurses Week. So yay, I love being a nurse. But for some context / background, I'm a travel nurse. I had just accepted a travel assignment. Well, not just. I had been planning on doing this travel assignment for about a month now. We're about 2 weeks out. And I got the call yesterday that my contract has been canceled. So I have no job now. I basically got fired before I even started at this job. And I even worked in the same hospital system in LA previously before accepting this job. And even on my last shift, I was out of the kindness of my heart. I worked a 20-hour shift. I literally worked 8 hours overtime because they were short-staffed. But you know what? Hospitals really don't care about you. That's what I've learned from this. They could care less if you're a good nurse. They just are about their money. So happy Nurses Week, everybody. I hope your Nurses Week is better than mine because I'm fun unemployed right now.
So I called off tonight because I'm just like so behind on my assignments and stuff. And also, I'm burnt out. Like, when I called them this morning to call off, they're like, "Are you sick?" I was like, "No, I'm burnt out. I'm done with the capping, bro. Like, I'm done lying."
I lost my job on Monday. No, I'm not a federal worker. I work in healthcare and I work from home. This is not a small company. This is a company like United Healthcare, Blue Cross Blue Shield. Don't want to really specifically name my company, but yeah. So some of these healthcare companies depend on government subsidies to keep things going for their members. And my company was one of those. Back in November, right after the election, we had a meeting and they told us like, hey, we might be doing some layoffs and some terminations. However, we don't know yet. We're playing it by ear. Well, the day after the inauguration was the first meeting. If you received that email, you were let go. So people lost their jobs. I'm not sure how that was picked because some people that got to stay had issues like were not hitting their metrics, and some people that left had no issues whatsoever. But they have said that they have not received any unemployment, anything of that nature. Now, with me, they told me I was eligible for unemployment. I'm not sure how that's going to work since the people who's been gone since January said they ain't received a dime. A little context to this is I started this job back in March of 2024 and was in training until June of 2024. And they told us that, hey, after you've been here for 1 year, you're going to start doing some of the harder work, working in some of these government systems where you're going to have to get approved to even use these systems and things of that nature. It was all a lie. From June 2024 until like November 2024, I was trained on everything within my department. And by December of 2024, I was being required to hit all the metrics for everything within my department. On top of that, I was also selected every single time for every pilot that was sent out for us to try things out while still doing my job, while still hitting my metrics. And yeah, these are the same things that people that have been there for 5+ years, they're doing it. And they're expecting us to have 100% doing it. Said all that to say this is not to scare you. This is just telling you to be proactive. Once they told me that it was possible layoffs happening, I went and updated my resume. I started applying for different positions. The same day that I got let go, I had an interview that day because I had already been applying. I'm not sure if I got the position or not. No, I'm not a big creator, so I don't get paid a lot of money off of here. This will be my first actual whole month.
Right on the heels of National Nurses Week, New York Presbyterian Hospital has announced its plans to lay off about 2% of its workforce, which equates to about 1,000 employees. Don't know yet exactly what the breakdown of those employees is going to be, but we do know that it includes nurse practitioners and nurses. They are allegedly laying off all of their nurse practitioners except the ones that were hired before 2010 and have allegedly already laid off 50 RNs from the Columbia campus, from what I'm told. But are they not still building a new cancer center and like enlarging another hospital? But they're citing financial difficulties. Why? Why are they having financial difficulties? That's a great question. I'm glad you asked. Last week, Columbia University and New York Presbyterian Hospital announced that they have settled a massive class action lawsuit for $750 million involving 576 patients that have accused an OBGYN by the name of Dr. Robert Hayden of sexually assaulting them between 1987 and 2012. But wait, it gets worse. According to federal investigators, Columbia University knew about this for years and years and continued to allow the OBGYN to work for years as patients continued to come forward. Finally, in 2020, federal investigators began investigating. And they have alleged that Columbia University failed to inform the DA when more patients continued to come forward and that they withheld evidence. And to date, as far as anyone knows, no one with Columbia University or New York Presbyterian, none of the employees there have been terminated or resigned in the wake of this. He was finally sentenced in 2023 to 20 years in federal prison, thank goodness. But Columbia University, they have not had to admit any fault whatsoever. But they're now paying out $750 million in settlements while they let him continue to do harm, to actively harm patients. And now, as the trickle-down effect, nurses and nurse practitioners and other healthcare professionals are being laid off. If that doesn't piss you off. The epitome of corruption. And this is not an isolated incident. Stuff like this happens all the time. They always cover it up, especially when it's a doctor.
Why is it normalized for people to have two jobs and have a side hustle just to survive?
$15 an hour is poverty.
What should be considered in a livable wage?
Oh, nobody wants to work anymore. This generation's so lazy. I'm applying for jobs right now. I am looking at jobs online. I'm sorry, $3.27 an hour, $1 a year. And these are not restaurant jobs either. I'm fully aware that waiters and waitresses make all their money from tips and they make below minimum wage. These are not restaurant jobs. This is working at a shoe store. This is working at the winery. What the fuck? And yes, also I'm aware that it says part-time jobs. I'm looking at part-time, full-time, literally any job that I can get my hands on. They're all like this. I mean, like, other than the gas station, the grocery store, and the nearest hotel, this is what the job options are like. Nobody wants to work these days. No, they're not even paying a livable wage. They're not even paying minimum fucking wage. Because what the fuck is that? $3.27 an hour. I would have to work over 3 hours just to afford 12 eggs. And you think our generation can afford rent? You think that we're just lazy and we don't want to work? Yeah, you.
What should be considered in a livable wage? You guys tell me. Are we talking about essentials, food, clothing, and shelter and utilities? Or are we taking into account streaming services, internet, being able to actually get out of the house and get a Happy Meal every now and then?
I'm convinced $4 an hour is the new 18. What you used to could do for $18 an hour and how you could live, now you pretty much have to make 40 to do the same thing. Anytime you have any kind of come up or raise, they just tax you more and everything gets more expensive. It's almost like it's designed so you can't get ahead. But you got people paying $400,000 to $450,000 for a 2,000 square foot house, 3 bedroom, 2 bath. And what is your payment on that a month? $2,400? That's insane. People paying $100,000 for an SUV, and 9 out of 10 of them don't make it 50,000 miles before some major recall. Like, how do we even get to this point? And you've always got those people that say, $4, that is excellent money. Yeah, if we were still living in the 1980s, Margaret, but it's 2025. The economy's trash, everything's expensive, and like I said, the system is designed so you can't get ahead.
Can someone explain to me why is it that the minimum wage is not a livable wage? Because I'm not really understanding, and maybe someone can explain it to me because it really doesn't make any sense. Here in the state of Florida, the minimum wage is $12 an hour. And I understand that most people do not get paid minimum wage. A lot of people get paid more than minimum wage. But here's the problem with that. A lot of companies think that they're being generous because they're paying above the minimum wage, when minimum wage is literally like on the floor in hell. Like, you cannot live on minimum wage. If you are getting paid minimum wage, you need government assistance. You are living in poverty. You are making less than $20,000 a year. Not one person can survive on that. You're making less than $20,000 a year working full time. Why is that the minimum wage?
Today a recruiter called me and I just had to tell her the truth. So a recruiter calls me and tells me that she has a position for me as a patient care coordinator in Alpharetta, Georgia, and it is in person. Now, I already don't want to go into anybody's office, but I told her, ma'am, if you don't live within 5 to 10 to 15 mile radius of where you're going to work in Atlanta, the traffic is not even worth it. I said, so please tell me the salary matches these requirements along with this location, along with being in person. She said, well, what are you expecting? I said, I don't want to tell you what I'm expecting. I just want to know what the salary is. What is the budget for this position? She said they're paying $18 an hour. I said, ma'am, respectfully, you need to offer this job to a kid who just graduated from high school or somebody who just retired, and they can couple that $18 an hour with a retirement check. I have 10 plus years in my other experience. I went to college, busted my behind, coding classes, got an IT degree, specialized in health informatics. I offer people to tell me I'm worth $18 an hour. You can kick rocks. I'd rather be poor and work for myself and figure out my business until I can get it off the ground. There's other things I could be focused on right now than working for somebody for $18 an hour. So respectfully, ma'am, no thank you.